Hi, and welcome back to our second video continuing with vitamins. This video will cover supplements and the water-soluble vitamins, which are vitamin C and the B vitamins. So, supplements. What would be the difference between taking a vitamin C supplement compared to eating an orange? Hopefully you know that oranges are high in vitamin C. What might you be missing if you are taking the supplement rather than consuming the orange itself? So this would be a pair and share, turn and tell your neighbor, talk about it question, but maybe pause and think about a few things that we might be missing when taking a supplement compared to the orange itself. So some of the things that I have come up with are calcium. So there's calcium in oranges. Calcium helps with bone strength. Beta carotene. Beta carotene helps with our immune system. Fiber in the orange. It helps you to keep full for longer. It slows the absorption of other nutrients. And then you would also be missing out on some simple sugars, which would give you that energy. So vitamin C helps us with our healthy immune system. It helps to absorb iron. This is not anti-supplements by any means, but just letting you know that when you eat the whole food, there are components that you're getting that you're not going to be getting in a supplement itself. So Dr. Walter Willett says we should take a vitamin. We should take a vitamin because it is like a life insurance policy. We hope to never use our life insurance policies, but if something happens and there's a life insurance policy there, we are grateful that it's around. We're grateful that it's able to take a role as a life insurance policy. So same thing with vitamins. We hope to make good choices and to get our vitamins and minerals from the foods that we're choosing to eat. However, when we're not making fantastic choices during a meal, during a day, during a week, during a month, during your lifetime, vitamins acts as a way to fill in the holes and the gaps of the missing nutrients that we're not getting in our actual food consumption itself. So years ago, the American Medical Association said, you know what, vitamins are a waste of money. We just urinate them out. We have the richest urine in the world. But nowadays, it is considered to be a benefit because so many people are not consuming proper foods that have the nutrition that they need. So more than 90% of Americans are getting less than the estimated average requirement for vitamin D and vitamin E from their food sources alone. If you're interested in reading more about this, you can see this website down here, Harvard School of Public Health. It's a nutrition source / multivitamin. A lot of different foods are fortified. So remember, enriched is when you take something out, you process it, you refine it, and you put some of it back in. Fortified is when you add something to a product that doesn't naturally have that. So milk is often fortified with vitamin D. Vitamin D allows us to take in and to utilize more of the calcium that's in the milk. And so when you have vitamin D in the presence of calcium, then your body can utilize more of it. Milk, margarine, different products are fortified with vitamin A. Flour and other grains are often fortified with iron and the B vitamins. Fruit drinks, the kinds that are not 100% fruit, are often fortified with vitamin C. And in breakfast cereals, sometimes, depending on the cereal that you choose, there can be an entire multivitamin that's been fortified within it. One thing that is amazing is that our body can't tell the difference between consuming foods and taking a synthetic supplement. However, again, remember, you don't necessarily know what you're missing out on when you're taking the synthetic supplement because of all of the unknown phytochemicals in a whole and natural food. Supplements, vitamins, different things within our body interact in different ways. So I mentioned this in the last slide. Vitamin D helps us to absorb more calcium. So if you are low in calcium, try to consume foods high in vitamin D when you're consuming your foods in calcium or beverages so that you can absorb more. Vitamin C helps us to absorb more iron. So if you have ever been tested and you're low in iron, or you've tried to donate blood and you're low in iron, or if you're prone to anemia, then when you're consuming foods high in iron, so say you're having a spinach salad, which has a lot of iron in it, throw some strawberries on it because strawberries have vitamin C, and that will help you to absorb more of the iron. So eating a combination of foods, colors, variety, and such helps to ensure that you're getting all of the vitamins and minerals that you are in need of, rather than just getting the same ones or a few of them over and over again. And before I continue on to our water-soluble vitamins, it is important to note that you can take too many vitamins. You can take higher than the recommended daily values. And so be cautious about that, especially with the fat-soluble vitamins, which are getting stored in our body. So make sure that you're not taking over the recommended doses. So our water-soluble vitamins, so our vitamin C and our B group. So water-soluble vitamins, they need to be replaced daily. They dissolve in water. They're not stored in our liver. They're not stored in our body. They travel throughout our bloodstream, and you will urinate anything that's taken in excess. So the B groups, there are 8 B groups, B vitamins, which I will only cover a few of them in detail, and then vitamin C. So our B vitamin is known by its name or number. So B1 is thiamine. They are considered the energy vitamin. They don't actually give our body energy. However, they help our body do functions and processes that aid in metabolism in things that then do give us energy. They're not stored in the body, so they're a water soluble vitamin, and they need to be replaced on a regular basis. So the focus of the B vitamins is this: eat real food. When eating grains, make sure that they're whole grains. Eat a variety of foods for proper energy in your lives. Know this about the B vitamins: people who consume alcohol on a regular basis do not absorb vitamin B as well as those not consuming alcohol on a regular basis. Other sources are meats, grains, beans, and nuts. So a deficiency in B1, thiamine, it can cause a loss of sensation in your fingers. You'll notice this in severe alcoholics: a jerky eye movement, a staggering walk, disorientation even when not drunk, and something called beriberi. So this is, you can see the picture there. This is something historically, beriberi occurred in regions where people ate dehusked or polished, or what we call white rice. When you're eating white rice, you're not getting the B1, you're not getting the thiamine. The reason that it is dehusked is that it allows the rice to have a longer shelf life. So it is better for grocery stores for them to be able to store it for longer, but it's not necessarily better for our overall health. So this is a picture of a man who has beriberi, loss of muscle function, sometimes paralysis of the lower leg, the swelling of the lower legs. Not something that we see here in the US very often. Here is a picture of a vitamin B2 riboflavin deficiency. This is probably the B group that is known as most as the energy vitamin. This helps with skin health and vision. Sources of riboflavin are animal meats, milk. Those are probably the main sources, as well as there are plant-based sources as well. Here is a deficiency of B3, which is niacin. Also helps in energy metabolism, helps with skin health, aids in our nervous system functioning correctly. Pellagra, again, is something we don't see too often here in the United States, but it can be common in people who eat mostly corn or mostly maize as their main staple of food. It can also be seen here in the U.S. in our homeless community and in in people who are alcohol dependent, because again, they're not able to absorb the B vitamins as well. So B9, folate or folic acid. This is a really, really important one. The United States FDA requires folic acid to be added as an enriched product in almost all grains. And this is so that we can lessen the likelihood of birth defects like spina bifida. So in the United States, half of all pregnancies are not planned. which is why the CDC recommends all women of childbearing age. So they say everybody, every female who is 15 to 45 or 50 should consume folic acid. It can be in the form of a multivitamin on a regular basis. It can only be effective in preventing spina bifida when it's taken in the first few weeks of conception, and that is usually before a woman knows that she is pregnant. So spina bifida is an abnormal portion of the spinal cord protruding through the openings in the bone. It can be surgically closed after birth, but that part of the spinal cord will be dysfunctional, and that baby, that child, will have nerve problems. This occurs in 1 out of 1,000 babies who are born with spina bifida. This next slide is going to have a picture of a real baby, so I'm just giving you a heads up. So this is a real picture of the occurrence, and it can be decreased. The occurrence of spina bifida can be decreased by up to 70% when daily folic acid is taken, again, prior to conception. So when you decide to start trying to have a baby, or when you're making decisions that might have a baby be the end result of that, taking a daily multivitamin and taking extra folic acid is really, really important. So we only covered a few of the B vitamins, but some things to remember. The B vitamins help the body's nerve and blood cells. It's not actually producing the energy, but our body uses the B vitamins to convert the food into energy. Like a lot of other things, as we get older and older, our body won't absorb certain vitamins. So you remember from our discussion on protein, we need more protein as we get older. It is the same with vitamin B, same with vitamin D. So supplements are often suggested for older people, and sometimes they're even suggested in the form of a shot. So you might see signs. There's a sign right outside on Rosecrans, not too far from Point Loma, that says vitamin B12 shots here. And then again, those who are regular drinkers of alcohol do not absorb vitamin B as well. So our other water-soluble vitamin is vitamin C. Some of the things that you might already know about vitamin C: it helps with our immune system, helps with our cells, helps also in growing strong bones. So it's also known as ascorbic acid, and our body doesn't make it. We need to be consuming foods or drinks or supplements, vitamins, with vitamin C on a daily basis. It helps hold our cells together. It helps to heal wounds. It helps to build bones and teeth. It helps in decreasing the length of a cold. And we can get it from citrus fruits, strawberries, melons, leafy greens, vegetables. Dark leafy greens have almost all vitamins in them, so they're always a fantastic choice. Vitamin C we generally think of in orange-colored fruits and vegetables. Vitamin C also, remember, is a complementary vitamin. So in the presence of iron, it helps us to absorb and utilize iron better. So if you are prone to being anemic, remember to consume more vitamin C's when you're taking your iron supplement or when you're consuming foods with iron. So this is a picture of scurvy. Scurvy is the disease that was essentially eliminated with the addition of a small glass of orange juice with breakfast post-World War II. It's pretty uncommon in modern society, but it is still seen in places with high numbers of refugees and some developing countries where their food sources are not dependable food sources, when they're not able to get fresh fruits and vegetables. Here are some examples of places other than oranges, foods other than oranges that you can consume that are high in vitamin C. So go ahead and look through that. The recommended daily allowance for us, as per the FDA, is 70 to 90 milligrams per day. More if you're a smoker. Dr. Walter Willett and the Harvard School of Public Health, they recommend 200 to 300 milligrams per day. Our body can only store about 1,500 to 3,000 milligrams at a time, so anything in excess of that can either be toxic, can cause diarrhea and other upset stomach problems, or is flushed out in our urine. So deficiencies are scurvy, as per the last picture, anemia, weakness of muscle, pain, slow healing, and such. So I've added this. We are in the midst of COVID-19, and there's a lot of information on social media about ways to protect yourself. Some of it is evidence-based research. Some of it is in clinical trials, and some of it is just kind of random. So I did a search of some articles that I thought were pretty relevant and pretty evidence-based. And this is an article that's really fantastic. So if you're interested in looking it up, it's healthline.com. Here's the title of it. You could probably Google it as well. But I want to highlight some of the important factors. So one of the ways that this article is written that I found was interesting is that it has a section and then it summarizes it. It has a section and it summarizes it. So if you want to read those 3 summaries, you may, while I'm also summarizing some of the things. So if you were to go to CVS or Rite Aid or Walgreens, you would probably see that the shelves are bare in the supplement aisle right now, especially vitamin C. So it's really hard to buy vitamin C, right? So social media claims are stating that vitamin C can help with COVID-19, but what does research really say? So no supplement can prevent or treat COVID-19. However, physicians and researchers are studying the effects of high doses of intravenous vitamin C. So this is something done in medical supervision, not in something that you could just orally take a lot of pills. The high dosage given by the IV in hospitals cannot be taken orally without medical care. And note that this is still in clinical trials. So this is not a standard part of the treatment plan because there's a lack of evidence. So this is very new research. What they have found so far is that taking more vitamin C does not mean your body is absorbing more, and high doses can potentially even cause diarrhea and other problems. So the best thing that is suggested right now, research-based, is to eat a diet full of fruits and vegetables. So this is then the bottom line of the article. Again, you can feel free to read it and other things. When you're reading articles, make sure that you're reading articles that are as unbiased as possible, that are not promoting a certain product, that are peer-reviewed, that are research-based, not just plugs and pop-ups on social media. So yeah, vitamin C helps us with our immune system. It helps us to function better. Research shows that if you are ill and you take high doses of vitamin C on a regular basis, that it will decrease your cold by maybe a day or 2, but it won't prevent you from getting that cold. My timer's going off now, so I'm going to go ahead and say goodbye.